who are the guys that need screening early, and who needs it 50 and who needs it 60? How do we get to know to keep people away from that hip fracture? Because I think for the layman out there, we have to say again, why are we doing this? Because a hip fracture, we've had Dr. Henny here that spoke about the hips, and he said, like, you have a 1 in 3 chance of dying from a hip fracture within the first 3 years of having a osteoporotic hip fracture. And so that is what we're trying to get away from.
And even with that, even those that survive, 50% of those people will never get back to baseline where they used to be. So your function in doing basic activities of daily life might be impaired quite a bit. So it is important. I agree 100%.
Yeah. Well, so the answer to your question has 2 parts. So the first part, we have to look at what the guideline says of organizations, IOF and NOFSA and so on. And then there's another leg, and that is the longevity approach, where we want to maybe look a little bit different at that doesn't sort of intervene upstream. But so getting clarity on what the guidelines says. And those guidelines are really solid, woven in science and evidence. And I think they remain the basis of who to screen. So firstly, the guideline says when you're 65 or older. So that is a clear indication for screening. When you are younger, and that is after 50, you need additional risk factors to be a reason for screening. And before 50, we look actually at osteoporosis a little bit different, understanding it different, because we're not sure how DEXA applies there, the testing, the bone scan, which we use as a screening, how to interpret the result in the young adult. And that is still needs to define. The definition of osteoporosis in a young adult is still not clear. So, and how to apply the DEXA scan. So that's where there is caution in doing that earlier. But the indications also says if you're a young adult, that means between, say, 20 and 50 in that time range. If you have other major risk factors that could be a secondary cause, a health condition that could be a risk factor, you may do a screening bone scan there. Obviously, if you break a fracture in that age range, you should definitely do that, because that is abnormal, a fragility fracture, obviously. But you need another clinical risk factor that is a significant risk for you to develop osteoporosis to do screening.